G'day and welcome to Nurse on the Go videos. My name's Phil and I'm going to show you today how to do some hand exercises. Now, mine are specific to my injury, so before you do yours, make sure you do it with your hand therapist because they'll show you the correct techniques of what to do. Now, the reason I've got hand exercises to do is from my injury, I cut my artery in my arm and I bled a lot into the muscles and stuff. So the problem with that is the blood that's inside, when it disappears or breaks down, it actually leaves scar tissue, and your ligaments that control your fingers they're like little bands that run up and down in your forearm. And what happens is the scar tissue can stick to the side of these little bands and stop them from moving. So I've been given these exercises to keep my hand moving and all my fingers mobile as much as I can. So there's no weight involved, it's just a hand. Do not use your other hand to push for my exercises I'm doing. And what I want to do is I've got to do these 10 times. Each exercise 10 times, so 10 repetitions, and I've got to do it 4 times a day. So that was my instructions for these. What I need to do is start with my arm straight up, so I don't use my other hand to push my fingers. I keep my fingers straight, and then I had to bend it down and leave it there for 3 to 4 seconds, and then straight up again, keep them up as straight as I can, and down again. And I repeat that for 10 times. And then my other exercises was to make a fist, close a fist, because what that does is moves all the bands up and down. So if any blood's sitting there trying to clot and form a scar, it will hopefully break it off. So I'll make a fist again, hold it, and then up. And then I've got to use my thumb to touch the tips of all my fingers. So I'll go my index finger, middle finger, ring finger, pinky, and do that. And so I do 10 repetitions of that. And then my other exercises, because it's not just a hand that's affected, I've also got my elbow. So I need to straighten my elbow out so it doesn't get tense. So make sure you can move your elbow. And then use my shoulder, so shoulder up and down, and do some rotation with my shoulder, so I can keep it as mobile as possible. Because the biggest thing about post-injury care is people not being consistent and doing their exercise regularly as they're informed to do, and what that can lead to is a more permanent disability. So if I wasn't doing these exercises, I just kept my arm in a splint and just let it hang down and not pay any attention to the advice I was given by my hand therapist and surgeon, I could actually end up with a contracted hand. So I'd have a hand like this. So what would I be able to do with that? Because the fingers wouldn't be able to stretch out, wouldn't be able to do anything. I wouldn't be able to hold anything in this hand, so it'd become useless to me. So by following the advice of your healthcare provider, making sure you do what they say to do, because they're the ones with the knowledge and experience in doing these exercises for you, getting you back rehab, getting you going as best they can. And your part to invest in that is to follow their advice. If you do have any pain or symptoms that you think's not right, go back and inform them. That's what they're there for. They want to see that you're as fit as you can be. They want you back to close to what your pre-injury state was. It's not always possible. Some people do have quite debilitating injuries, but that's the goal of rehab, is to get you back there. So your part to play in that is to do your exercises. Like me, I've got to do my exercises 4 times a day. Those exercises I just went through, to keep my hand moving as best it can, so I can keep as much function and hopefully get back to 100% in a few weeks. So my advice is, take the advice of the medical profession and the healthcare professionals helping you, like my hand therapist, and let them guide you with your rehabilitation and work out your limits, because they're there to work with you, not against you. And what you need to invest into it is your time and effort and consistency. And the hardest thing to do after 4 weeks is being consistent. To do these exercises, these little exercises you don't think are much, 4 times a day, 10 repetitions each for at least 4 weeks, maybe longer for me, I don't know. That's going to be my trick, is consistency. I'm good in the short spurts, like 3 to 4 days, I'll be fine with that. It's after that, it's keeping it going, because that's where the rehab really kicks in and gives you the benefits and gets you back to where you need to be. So I hope you get a bit out of that, bit of advice. My name's Phil, I'm here to help you care, and look forward to seeing you on the next Nurse on the Go video. Bye bye for now.